Alright, this is something truly heartbreaking and eye-opening. Emily Willis, the well-known adult film star, has suffered a devastating medical emergency that has left her in a vegetative state. Her real name is Litzy Lara Banuelos, and she was just 26 years old when she suffered a cardiac arrest at Summit Malibu, a rehabilitation center in California. What's shocking is that this tragedy has now led to legal action, with her family filing a lawsuit against the facility, claiming negligence and inadequate medical care. Now here's what makes this even more tragic. Emily was battling a severe addiction to ketamine before she sought treatment. Reports say she was using 5 to 6 grams of the drug daily, leading to severe health complications like bladder inflammation, night terrors, anxiety, and even PTSD symptoms. She finally decided to turn things around and checked into rehab, hoping to get better. But instead of receiving the care she desperately needed, her family alleges that she was neglected, leading to irreversible brain damage. Let's talk about what happened leading up to this heartbreaking event. Emily was admitted to Summit Malibu on January 27, 2024. Over the next few days, her condition reportedly worsened. She showed signs of dehydration, extreme fatigue, and disorientation, but the staff allegedly ignored these warning signs. Then, on February 4th, she suffered a cardiac arrest. But here's where it gets even more disturbing. According to the lawsuit, the facility didn't call for emergency help right away. They tried to monitor her internally until a nurse eventually found her unconscious. By the time paramedics arrived and performed CPR, her brain had already been deprived of oxygen for too long. The damage was done. Now her family is fighting for justice, filing a lawsuit against Summit Malibu and its parent company. They claim the facility was grossly negligent and failed in its duty to provide proper medical care. Their attorney, James A. Morris Jr., has been vocal about how unacceptable this is, stating that no patient should ever experience such a complete breakdown in care. What's also important to note is that medical reports confirmed Emily had not relapsed or consumed any substances prior to the cardiac arrest, meaning this wasn't a case of overdose, but rather a failure of medical professionals to act in time. Doctors are now using this case as a warning about the dangers of prolonged ketamine abuse. Dr. Suzanne Wiley, a medical expert, has spoken out about how excessive ketamine use can lead to severe physical and mental health issues, including bladder damage, heart problems, and even long-term psychosis. She also emphasized how critical it is for rehab centers to have the proper medical resources to handle patients with severe addiction histories. As of now, Emily remains in a semi-conscious state. She can track objects with her eyes but is unable to speak or move. Doctors are not optimistic about a significant recovery, but her family is holding on to hope. Beyond her personal tragedy, this case is shining a light on the need for better oversight in rehab facilities. Too many treatment centers prioritize profit over patient care, and this lawsuit could be the push needed to demand better standards and accountability. This is a heartbreaking reminder of how dangerous addiction can be, and how crucial it is for rehab centers to be properly equipped to handle medical emergencies. We'll be following this case closely, and hopefully, Emily's story will bring about much-needed change in the way addiction treatment centers operate.